Today's discussion will be treating Alzheimer's disease with Donanemab. The objective is to explore Alzheimer's disease as a neurocognitive disorder and Donanemab as it is used as a new treatment method for the disease. We will also cover our bases on pre-existing treatments that exist for Alzheimer's disease. It is important to understand the disease and how it presents before understanding the medications that are used to treat it. Some of the symptoms include cognitive symptoms like memory, attention, and visual perception deficits. Emotional symptoms include anger and frustration, sometimes attributed to feeling frightened, embarrassed, or humiliated. Also, somatic symptoms include loss of balance and muscle weakness, and behavioral symptoms include refusing help, hoarding, or repetitive behaviors. Microscopically, the deficits that we see in Alzheimer's disease can be attributed to the abnormal cleaving of beta amyloid, or the amyloid precursor protein. So usually alpha secretase is responsible for cleaving the amyloid precursor protein. However, in an abnormal situation, beta secretase and Y secretase abnormally cleave and therefore result in beta amyloid plaques. Additionally, we see hyperphosphorylation of tau proteins, which are usually used to stabilize microtubules, and in an instance where they're hyperphosphorylated, the tau detaches from the microtubules and forms neurofibrillary tangles, which can lead to cytoskeleton collapse. Here in this image, we see the disintegrating of the microtubules due to the hyperphosphorylated tau and the cytoskeleton collapse. Essentially, this process can cause neuron cell death, generally seen in the hippocampus and the amygdala of the brain, which are responsible for the emotional processing and memory. This image will show the barrier that we see in communication because in spaces in the brain where neuron cells die, the beta amyloid plaques will try to take up this space, essentially inhibiting essential communication between one neuron and another. One of the current treatments that we have that we generally use is a cholinesterase inhibitor. A cholinesterase inhibitor inhibits acetylcholinesterase in the synaptic cleft, which will increase levels of acetylcholine as an excitatory neurotransmitter. The hope is that if we increase the levels of acetylcholine in the synaptic cleft, that this will compensate for the barriers seen with our neurofibrillary tangles and our beta amyloid plaques impeding on the communication between two neurons. An NMDA receptor antagonist is also used in the treatment of Alzheimer's, essentially trying to compensate for the increased glutamate due to beta amyloid plaques. So beta amyloid plaques prevent the recycling of glutamate, and therefore glutamate is constantly activating NMDA receptors, and therefore an increase in ions such as sodium, potassium, and chloride are seen in a neuron, which causes a disruption in the signal transduction. So the hope is that if we use an NMDA antagonist, we can stop the interruption of signal transduction in subsequent neurons. Donanemab is the new treatment that we are going to be centralizing our focus. It's an anti-amyloid antibody intravenous infusion, essentially a monoclonal antibody that is responsible for directly targeting beta amyloid plaques, and it is administered intravenously. Donanemab is used in the early stages of Alzheimer's disease. Some of the benefits that we see in Donanemab include slowing the progression of the disease, and also faster amyloid plaque reduction is seen in the use of Donanemab as compared to other drugs such as lecanemab that are used in the treatment of the disease. The limitations of Donanemab, essentially analogous with all Alzheimer's disease treatment medications, are that it cannot restore or reverse cognitive function that has already been lost. Side effects include amyloid-related imaging abnormalities, which can be microhemorrhages or small amounts of edema seen on imaging, as well as headache. The mechanism of action of Donanemab includes Donanemab binding to position 3 of the beta amyloid plaque, specifically position 3 of the proteoglutamate modified beta amyloid plaque. So As it binds to this beta amyloid plaque, the microglial cell will be stimulated to phagocytosize because it recognizes the antibody. Specifically, the Fc receptor on the donanemab or the Fc region of the donanemab will bind to the Fc receptor on the microglial cell, stimulating phagocytosis of the monoclonal antibody and the plaque. Essentially, this response, because donanemab is a monoclonal antibody, is an immune system mediated response. In a clinical trial using donanemab, a population of patients with early stage Alzheimer's, all having the presence of a beta amyloid plaque, they use a double-blind control trial with an 18-month-long treatment plan. And of the population that were involved, it was seen that there was a reduction of amyloid plaques due to the phagocytosis, and there was a slower cognitive decline, specifically 35% slower cognitive decline seen in those receiving the drug. They also seen less progressive deficits in activities of daily living. We might want to ask, why is donanemab a superior treatment as compared to a cholinesterase or an NMDA receptor antagonist? So as we said, the cholinesterase inhibitors, so they try to increase acetylcholine in the synaptic cleft, and the NMDA tries to smooth out signal transduction. So they try to compensate for the barriers seen from the beta amyloid plaques and the hyperphosphorylated tau proteins. But our donanemab directly acts as a disease-modifying approach because it is trying to phagocytosize the beta amyloid plaques directly. Based on the pathological understanding of Alzheimer's disease, how might future therapies in conjunction with donanemab be used in the treatment of the disease? So essentially, donanemab tries to phagocytosize the beta amyloid plaque once it's already formed. However, we have other medications such as donanemab, which binds to the N-terminus of the beta amyloid fibrils before they form a plaque to try to stop that aggregation from happening. Also, lecanemab, which we've already mentioned, selectively binds to soluble beta amyloid protofibrils, also trying to prevent the aggregation of that plaque. So in essence, these three medications are essentially working on the oligodimers or the beta amyloid plaque as a direct method of treatment for Alzheimer's disease. We might want to ask, why might some patients not benefit from donanemab? And this is because once neurons already die, okay, they cannot be restored. So in scenarios of a really progressive case of Alzheimer's disease or a really progressed case of Alzheimer's disease, these permanent cells cannot be regenerated and they will be lost indefinitely. And this is what this image here is showing. So essentially, intracellular support and communication are permanently impaired, and neuron cell death, as we know, is an irreversible process. So donanemab is most efficiently used before we have too much of a deficit due to the neuron toxicity and neuron cell death. Thank you for watching.